Modifier 25 is used in medical billing to indicate a significant, separately identifiable evaluation and management (E.M.) service. This modifier applies when the E.M. service is performed by the same healthcare provider on the same day as another procedure or service. The E.M. service must be distinct and go beyond the typical pre- or post-operative care associated with the procedure. Modifier 25 ensures appropriate reimbursement for additional cognitive work performed during the patient encounter. Without Modifier 25, the E.M. service may be bundled into the payment for the procedure, resulting in underpayment. Accurate application of Modifier 25 requires clear documentation to support the distinct nature of the E.M. service. Modifier 25, as defined by the current procedural terminology, CPT, manual, signifies a significant, separately identifiable evaluation and management service. This modifier applies when the same physician or qualified healthcare professional provides the service on the same day as a procedure or other service. The official definition emphasizes that the evaluation and management (E.M.) service must be both significant and distinct. Modifier 25 ensures appropriate billing for E.M. services that are substantially separate from other procedures performed. Proper application of Modifier 25 requires careful documentation to support the necessity and distinctiveness of the E.M. service. Modifier 25 is applicable when the evaluation and management (E.M.) service is distinct from the procedure performed. Modifier 25 indicates that the E.M. service goes beyond the typical care associated with the procedure. For example, a general checkup followed by addressing a skin lesion during the same visit warrants Modifier 25. The E.M. service must be separately documented and justified to appropriately use Modifier 25. Modifier 25 should not be appended if the evaluation and management (E.M.) service is an inherent component of the global procedure. Modifier 25 is inappropriate when the E.M. service is a routine aspect of the procedure without a separate diagnosis. Absence of distinct documentation to support a separate E.M. service renders Modifier 25 usage incorrect. Modifier 25 should not be used for services that lack medical necessity. In summary, Modifier 25 requires a distinctly separate and medically necessary E.M. service, supported by thorough documentation. Modifier 25 usage requires thorough documentation to support the distinct evaluation and management (E.M.) service. Documentation must clearly demonstrate the separate and identifiable nature of the E.M. service provided. Distinct diagnoses, when applicable, should be clearly documented to justify the separate E.M. service. The medical record should include time spent, a detailed patient history, and thorough examination findings. Clear medical decision-making, MDM, must be evident within the medical record to support Modifier 25. Modifier 25 overuse on all E.M. services is a common billing error. Lack of sufficient supporting documentation leads to Modifier 25 claim denials. Applying Modifier 25 to non-E.M. codes is an incorrect billing practice. Using Modifier 25 for routine post-operative visits without justification is inappropriate. These Modifier 25 errors can result in claim denials and audits. Correct Modifier 25 application requires careful documentation and code selection. Many payers, including Medicare and private insurers, frequently audit claims with Modifier 25. Adherence to payer-specific policies and guidelines regarding Modifier 25 usage is essential. Healthcare providers must be prepared for potential claim denials when using Modifier 25. Payers may request detailed documentation to support the use of Modifier 25. Thorough documentation is crucial for justifying Modifier 25 claims and avoiding denials. Correct use of Modifier 25 ensures appropriate reimbursement for legitimate evaluation and management (E.M.) services. Misuse of Modifier 25 can result in claim denials, audits, and recoupments of payments. Modifier 25 is a frequent target in healthcare fraud investigations. Accuracy in applying Modifier 25 is paramount to avoid legal and financial repercussions. Healthcare providers must maintain meticulous records and documentation to support Modifier 25 claims. A patient presents with chronic shoulder pain, requiring an evaluation and management (EM) service. During the visit, a trigger point injection is administered to alleviate the patient's shoulder pain. Modifier 25 is appended to the EM code to indicate a separately identifiable service. Separate documentation is required for the evaluation of the shoulder pain to justify the EM service. Medical necessity must be clearly established for both the EM service and the trigger point injection. Proper coding with Modifier 25 ensures accurate billing and compliance with healthcare regulations. Modifier 25 indicates a significant, separately identifiable EM service performed on the same day as a procedure. Thorough documentation is essential when using Modifier 25 to support the distinct nature of the EM service. Regularly review payer policies regarding Modifier 25 to ensure compliance and avoid claim denials. Ongoing training for staff and coders is crucial to ensure appropriate and consistent use of Modifier 25. Modifier 25 requires a thorough understanding to ensure accurate coding and billing. Addressing uncertainties about Modifier 25 is crucial for proper claim submissions. Accurate coding prevents claim denials and ensures appropriate reimbursement. Compliance with coding guidelines is essential to avoid audits and penalties. Proper billing practices contribute to the financial health of healthcare providers. Continuous education on coding updates is vital for maintaining accuracy and compliance.